Brain fog, bad breath, and belly fat may seem like completely separate problems. One sort of feels like a brain issue, one feels like a mouth issue, and one feels like a weight issue. But what if they're not always separate? What if these are different clues pointing toward the same deeper pattern? Inflammation, unstable blood sugar, oral imbalance, and poor cellular energy. Today, I want to connect these dots in a very simple way. Not to scare you, not to say one problem causes everything, but to help you understand why the body often gives signals before a bigger issue becomes obvious. Most people treat symptoms in isolation. Certainly, conventional medicine, that's the way it's done. So, for brain fog, they reach for caffeine. For bad breath, they use mouthwash. And for belly fat, they try yet another diet. But the question is, why are these symptoms showing up in the first place? Bad breath may not only be a mouth odor problem. Brain fog may not only be a concentration problem. Belly fat may not only be a caloric or calorie issue. So sometimes these symptoms are connected by deeper systems inside the body. The mouth, the immune system, blood sugar, metabolism, and mitochondria, they all communicate with each other. So this is where health videos become too abstract. They talk about mitochondria or inflammation in a way that feels distant from real life. But most people do not wake up thinking, well, I have mitochondrial stress. No, they wake up thinking, why am I tired? Why does my breath still stink? Why do I crash in the afternoon? And why am I gaining belly fat even though I'm still trying really hard to lose it? And this is where the real conversation should start. So let's build a simple root cause map. The first piece is the mouth. And of course, as you see, I'm an oral surgeon. I know plenty about the mouth. Your mouth has numerous bacteria, and that is completely normal. Well, when the oral environment becomes imbalanced, or another way of saying this is if the oral microbiome, you guys may have heard the term microbiome before, there's an oral microbiome or bacterial sort of group of bacteria in the mouth. When they become imbalanced or cause dysbiosis, then harmful bacteria can grow more easily. Now, that imbalance can show up as bad breath, bleeding gums, plaque buildup, gum swelling, or a mouth that never feels fresh. Now, the second piece is inflammation. If the gums are irritated or infected, the immune system has to respond. And that response may be local at first, but the mouth is still part of the body as much as the medical profession would like to separate us out. So chronic oral inflammation can become one part of the body's total inflammatory burden. Now, the third piece is blood sugar instability. And when someone eats frequent sugar, refined carbohydrates, snacks all day, or grazes, blood sugar can rise and fall repeatedly. And those swings can lead to cravings, sleepiness after meals, irritability, and afternoon crashes. Now, the fourth piece is mitochondrial stress. Mitochondria are those little energy engines inside your cells. They help to convert food and oxygen into usable forms of energy. But when the body is dealing with inflammation, unstable fuel, poor sleep, or low movement, cellular energy can be strained. So the simple map looks like this. Oral imbalance or dysbiosis may contribute to inflammation. Inflammation may add stress to the body, i.e., raising cortisol. Blood sugar swings may create unstable energy. Mitochondria may struggle in that stressed environment, and the person may become tired, inflamed, may feel foggy, or metabolically stuck. Now, this does not mean that bad breath causes belly fat, right? It does mean that these symptoms can sometimes belong to the same larger pattern or underlying root cause, right? So let's talk about why energy matters, especially when it comes to brain fog. Brain fog is very frustrating because it's not always super dramatic. You can still function, but you feel slower. You reread things, you forget simple words, you need more caffeine to get through a day. You feel mentally heavy after meals, and you lose focus in the afternoon. You start reaching for those energy drinks. Well, the brain is an energy-hungry organ. It needs steady sources of fuel, of oxygen, and healthy cellular function. So if blood sugar is swinging up and down and up and down and goes real high and then crashes down low, if sleep is poor or if the body is carrying chronic inflammation, then the brain may not feel sharp, doesn't utilize the energy properly. Now, that doesn't mean that every case of brain fog comes from the mouth or mitochondria. Brain fog can have many causes, including sleep disorders, anemia, thyroid issues, medication, stress, depression, infections, and other medical conditions. But from a root cause view, we should be asking ourselves, is the brain getting enough steady energy, or is the body constantly dealing with stress signals? All right, now let's talk about bad breath. Many people try to cover it. They cover it with things like mints or gum, mouthwash, or more brushing. But persistently bad breath may be a sign that the oral environment is not balanced, that dysbiosis I talked about before. It can be connected with gum inflammation, bacterial buildup, dry mouth. Dry mouth can do unbelievable amounts of damage. You can get decay and cavities rampant with a dry mouth, and periodontal disease or gum disease as well. Poor tongue hygiene or dental infections. All of these things are connected. But of course, bad breath can also come from digestion, not just oral problems. Things like, GERD or gastroesophageal reflux disorder can cause it. You can have sinus issues creating bad breath, smoking, medications, or dehydration. But if bad breath is persistent, like you treat it, you brush your teeth, you clean everything up, you use some mouthwash, and then the bad breath is still persistent, especially if you have bleeding gums or gum swelling, it should not be ignored. So the deeper question is the mouth giving a signal of inflammation or imbalance? Because if the mouth is inflamed, the body may be spending energy managing that inflammation every single day. And this is where the oral health connects to the whole body health. Another area that can be affected is if you have dysbiosis of the gut microbiome, and you correct that. If the mouth is not treated and the mouth, you have dysbiosis or imbalance in the oral bacteria, then that can affect the gut microbiome. So everything is connected: the oral microbiome, the gut microbiome, and a number of other microbiomes in our bodies. All right, let's talk about belly fat now. Belly fat is often treated like a willpower problem, but metabolism is far more complex than willpower. I'm here to tell you I have pretty tremendous willpower a lot of times when it comes to diet, and many times I still struggle with the belly fat. So when body sugar rises and crashes repeatedly, the body can enter a cycle of hunger, cravings, low energy, and overeating. So high sugar intake, low protein, poor sleep, stress, low movement can all make this worse. And over time, this pattern can contribute to insulin resistance and fat storage, especially when it comes to around the midsection, around the belly. And again, this doesn't mean that one snack causes belly fat, right? It does mean that repeated patterns matter. If someone has belly fat, cravings, afternoon crashes, and brain fog, we should not only be asking how many calories are they eating, we should be asking more important questions. Not that that's not important, but it's only one small item. We should be asking things like, are they eating in a way that creates stable energy? Are they sleeping well at night? Are they getting 7 to 8 hours of sleep? Are they moving around? Are they using their body? Are they getting their blood flowing? And is inflammation present? And if so, where is it? And how do we kind of correct that? Is the mouth healthy? Like I mentioned, the oral microbiome leads to everything else. And so we have to make sure that the mouth is a healthy environment. And is the body constantly trying to repair something? If your body has need for constant repair, it's utilizing tons of energy. And so that is the smarter conversation you should be having than just how many calories is someone eating. All right, here's what most people get wrong. We're going to talk about 3 myths. Myth number 1, bad breath is only about hygiene. And while hygiene certainly matters, I'm not here to tell you it doesn't matter. Please keep your teeth and your gums and your mouth clean. But persistent bad breath can also be a sign of oral imbalance, gum inflammation, dry mouth, cavities, and/or infection. So covering that smell up doesn't always solve the underlying cause. And here we always focus on the underlying cause. Myth number 2 is that brain fog is just normal aging. This couldn't be any further from the truth. Brain fog is common, but that doesn't mean it should be ignored, and it doesn't mean that it's normal, right? Poor sleep, unstable blood sugar, inflammation, stress, and health conditions can all affect mental clarity. So don't just attribute it to I'm getting older or I'm having a moment. Myth number 3, belly fat is only about calories. And while calories matter to a degree, hormones matter more. Not only do hormones matter more, but sleep, movement, inflammation, insulin resistance, and food quality also matter a great deal. So the body is not just a calculator. We are not bomb calorimeters. The bomb calorimeter is what decides how many calories a food has. It's like this little explosion, like this little chemical experiment that they do to calculate out how many calories a food item is. So we are not bomb calorimeters. We're not calculators. This is a system. We are, our bodies are systems. So here are some signs worth paying attention to. Bad breath that keeps coming back, bleeding gums, gum swelling, frequent cavities, cravings after meals, brain fog after eating, afternoon crashes, belly fat gain, waking up tired, feeling inflamed or puffy, slow healing, and low motivation to move. These are all signs that we should be looking at and paying attention for. These signs, though, they don't diagnose you, but they are clues. And when those clues appear together, they may help you understand the real bigger problem, the underlying cause. So first, stop treating the mouth as separate. We've talked about this before. If you have persistent bad breath, bleeding gums, gum swelling, tooth pain, signs of infection, get a professional dental evaluation. Second, stabilize your meals. Build meals around protein, fiber, and real food. Avoid starting the day with only sugar and caffeine. That will set you up for failure. And third, reduce constant snacking and sugar exposure. This helps both the mouth and blood sugar stability. Fourth, move after meals. Get moving. Take a short walk after having a meal. That can help the body use the glucose better and may support more stable energy. And then fifth, make sure you protect your sleep. This one goes overlooked by many people in westernized societies. Poor sleep can worsen cravings, can cause brain fog, create inflammation, and cause problems with metabolic health. And finally, get evaluation when symptoms persist. If you have ongoing brain fog, unexplained weight changes, uncontrolled blood sugar, persistent fatigue, pain, infection, or symptoms that are just getting worse, make sure you speak with a qualified health professional. And remember, this video is for education only and does not replace personal medical advice or dental advice. So, are brain fog, bad breath, and belly fat connected? Well, not always, but they certainly can be. They may be different signs of a body struggling with oral imbalance, inflammation, blood sugar instability, and cellular energy stress. But the goal is not to panic. I'm not here to cause everybody to freak out about what's going on. The goal is to stop treating every symptom like it lives in a separate box. The mouth over here, insulin resistance over here, belly fat over here. Your mouth, it gives you clues. Your energy, that gives you clues. As well as your cravings give clues and your metabolism gives clues. So remember, the smarter question is, what pattern is my body trying to show me? And if this helps you connect the dots, leave a comment below with the symptom that you think most people ignore the most. And make sure to subscribe for more root cause health conversations that connect the mouth, metabolism, inflammation, and long-term energy. I want to thank you for your attention and for taking the time with me, and I'll see you in the next video.